Hello, everyone. Welcome back to Dentist Insider, and today we'll start our first lecture here with in oral anatomy, oral gross anatomy. So we will talk about some peripheral nerves and the peripheral nerve receptors. So what are peripheral nerves in layman? Is basically how we feel anything like touch, vibrations, pressure, pain. Um, and other things like if you hit your head or hit your elbow as you're walking out of your room, that you might feel a slow pain, or a toothache is a slow pain, for example. And we need receptors for that. Just a quick overview. Here we have our skin, and we can see examples of these receptors such as free nerve endings. We also have Merkel cells, which are also found, both are found in the border of epidermis and dermis. And then we have follicular endings around the hair follicle, Ruffini endings. And then I would like to start with the outline of our concept today. So we will talk about number one, the peripheral nerve fibers, and we have different types to categorize them. So we will talk about 1 to 4. Then we have peripheral sensory fibers and their receptors, talking more about the stimulus and what type of receptor is activated. Then we will talk specifically about the receptors for muscles and joints to cause contraction and stretching, and then receptors in the skin for pain, temperature, um, and then related to dentistry, oral receptors. So let's jump right into it. And first one will be the peripheral nerve fibers. So we have motor and sensory, and they're based on the diameter and the velocity. And then we know they go from 1 through 4. And 1 through 4, 1 is the largest and most myelinated and the fastest. And then 4 is the slowest, slow pain, unmyelinated. And here in point 2, we talk about their increase in their myelination, or this is a rank of their velocity. So 1A the fastest, 1B, 1 delta, and then C is the slowest, slow pain. In muscle and joint receptors, we have the muscle spindles, which are 1A type, and then we have Golgi, which is used for flexing, is 1B. And we also have some free nerve endings. In skin, we have Merkel, which are type 2, and they're slow adapting. Meissner's, I call them messy. They're also number 2. Folliculars are also number 2. Ruffini is type 2. Pacinian is also type 2. So basically, only in the muscle is where you have type 1A and 1B for the muscle spindle, and then Golgi tendon organ. Whereas in the skin, mostly are type 2 receptors. Okay, so here we have a quick picture with everything in one. So we have on our left here, we have some proprioception, receptors. So these tell us position. So how does the body know about the balance if we're standing upright or if we're tilted a little bit? And these are the fibers that will, with the help of the tendon and the muscle, will tell where we are in time and place. So we have two types. We have the muscle spindles, and then we have Golgi tendon organ. Muscle spindle we know are type 1A, and Golgi tendon organ is 1 type B. And here you can see we have an extrafusal muscle fiber, which is a whole one whole muscle fiber, and it's made up of many intrafusal muscle fibers, and they have these kind of annular springs we will talk about later that wrap around, and so that is your muscle spindle. And once again, we have spindle has an L in it, so muscle spindle tells us about the length, whereas the Golgi tendon T tells us about tension. So 1A is about for length and 1B is for tension. Next, we can go to our cutaneous mechanoreceptors. So these are just cutaneous, mechano, so some skin receptors, skin and oral, basically for both. And we will start with from left to right. So we have the hair follicle right here. and they are A beta fibers. And what down here we have RA and SA in most of these, and I will just explain that real quick. So if you have RA stands for rapidly adaptive. So if the receptor gets increase in stimulus, rapidly adaptive will shut down. So RA, rapid, they adapt rapidly, basically, and they're able to figure out that this is too much stimulus, and they will shut off. Whereas SA, the slow adapting, it takes some time to figure out the increase in the pain stimulus or pressure stimulus, and they will keep firing for a long time. So all it means is one is slow, one is fast. So A beta is both slow and fast adapting, or the hair follicles are A beta. Then we have free nerve endings, which are some C fibers, and they tell us mostly about slow pain. They're unmyelinated. Then we have A beta fibers in the Meissner corpuscle up top. So we have Meissner corpuscle with its A beta fibers, and then we also have Merkel cells with their A beta fibers. And then you can see the differential is that one Meissner corpuscles are RA or rapidly adapting, whereas Merkel cells are slow adapting. This is due to the fact that our Meissner corpuscles are for vertical pressure or fine 2-point discrimination, whereas our in the Merkel cells, A betas, they're slow adapting because they are for the blunt pressure, and they keep firing till the action, as long as the action potential keeps going. So more fine, sharp pain. So I'll write that here. Will be this is more sharp pain, and this is more dull pain. As then we also have some A delta free nerve endings, and down here we will talk about Ruffini endings and Pacinian corpuscles. So Ruffini endings are A beta, they're slow, whereas Pacinian corpuscles are also A beta, but they're fast, rapidly adapting. This is once again, it will make sense if you try to understand the SA and RA. So if you have slow adapting Ruffini endings, they're mostly for some type of drag, shear, tooth displacement in dentistry. So slow movement. Whereas A beta rapidly adaptive are very highly sensitive to vibration and pressure. So once again, if you look at the similarity, we had our Meissner corpuscles, which were sharp, whereas the Merkel cells were dull. And Merkel cells that were dull are slow adapting, whereas Meissner corpuscle sharp was rapidly adapting. Similarly, we have Pacinian corpuscle, which is rapidly adapting, like Meissner corpuscle, and it is like the fine 2-point discrimination. This is highly sensitive vibration and pressure, just like Merkel cell, which were for dull, blunt pressure, and had slow adapting. We have Ruffini endings, which are also slow. They're for drag and shear forces, like tooth displacement. So as we keep going, here's a quick chart. We can run through that real quick. Here, all it's saying is that we have different types of myelinated nerve types. We have type 1, type 2, type 1, type 2, type 3, type 4, and they are getting lesser in myelination, or we can say that they increase in myelination as we go up. They also increase in diameter as we go up, and they also increase in velocity as we go up. So number 1 is the largest, most myelinated, biggest diameter, highest conductive velocity, whereas C is the unmyelinated, type 4, the smallest diameter and the slowest velocity. If we talk about the sensory receptors, we can see that type 1A, like I said earlier, type 1A is for muscle spindle, and there are spiral endings. I can show you that. Whereas there's another muscle spindle in type 2A beta, which is flower spray. Well, going back, 1A is for muscle spindle as well as Golgi tendon organ, whereas 2 is for muscle spindle flower spray, 3 is for fast pain, and 4 type C is for slow pain. Going back, there is a quick picture I can show you right here. So we have our afferent fiber right here, going to tell us about our pain or pressure, and you can see there is the flower spray ending, as I was talking about in type 2 A beta, and here is the spiral ending around the muscle, and this is type 1A for the muscle tendon, or Golgi tendon, and muscle spindle. So once again, let me just check I didn't miss anything. So we talked about point 1, which is diameter and velocity. Increase in the highest diameter, highest velocity is type 1. The lowest is type C or type 4. Then we talked about the muscle joint receptors as well as the cutaneous mechanical receptors, which are mostly type 2. And finally, oral receptors for touch and pain. So here we have oral receptors. We will talk about just touch and pain and temperature. Starting with touch, touch is by afferent A beta fibers, whereas the pain and temperature mostly is by A delta and C fibers. Mostly C we will study about in the future are the free nerve endings that tell us about the slow pain. Going back to touch, in the oral cavity we have same receptors that we found in the skin, like the Merkel cells, Meissner corpuscle, Ruffini endings, Pacinian corpuscles, and once again the slow adaptings, they're very similar, and then the rapidly adapting were similar to each other. So this should be everything about peripheral nerve receptors. We talked about the stimulus, we talked about the peripheral nerve fibers and what they do. So finally, in conclusion, I would just like to do an overview of the main things. So we have 4 types: type 1, type 2, type 3, and type 4. Type 1, I'd like to then talk about. They are the A alpha type, A beta type. Type 3 is both A delta, and type 4 is C fibers. They increase in myelination, diameter, velocity as we go up, or they decrease as we go down, whatever you want to call it. And then we know that the receptors for type 1 is mostly the muscle spindle, is only muscle spindle and Golgi tendon organ. And once again, spindle has a L in it, L for length, so this will tell us the length, whereas Golgi tendon organ, it has a T in the middle, and T will tell us about the tension. Then we have type 2, which are mostly which have muscle spindles, but the flower endings that I showed you earlier. So they are the flower endings. This will also tell us about the touch and some type of pressure in the skin and oral pressure or vibration. Then we'll go to type AD. AD will mostly tell us about the fast pain or change in temperature, mostly cold temperature, but fast pain and thermal. Whereas type C will tell us about slow pain and slow itch or some type of pressure. Oops, sorry, this is supposed to be slow pain and itch. My mind goes faster than I can write. So that should conclude all of that. Oh, lastly, the way I like to remember this table actually is that type 1 we sit, 2 we touch, 3 is fire, and 4 is slow death. So one sit, 2 touch, 3 fire, 4 death. But slow death. So one sit meaning we use our muscles to sit. So that will only be type 1A and type 1B. So we know muscle spindle is 1A, Golgi tendon organ is 1B, and then we know muscle spindle is to measure the rate and degree of a stretch or the length, and type 1B is for T, tendon. Tendon is for tension or the muscle force contraction. So when you flex, tension. Then type 2 is for touch. So you want to touch the flower, basically the flower, and some skin and oral pressure. I forgot the mnemonic I had there, but you want to do a light touch to the flower, so that's type 2. Type 3 is going to be fire, so that is fast pain, fast, high temperature. And then type 4 is slow death, so slow pain will be type 4. And that should be everything about peripheral receptors. Next, we would link this into our somatosensory cortex and try to understand how pain and temperature and fine touch vibration is basically sent up to the brain. Thank you very much.